Guys, this video is going to be about therapy, just kind of my viewpoint on it and how I feel about it and stuff like that. I personally think therapy is a good way to start your transition off. Just be honest with yourself. If there's any underlying issues, if you have any sort of anxiety, social anxiety, mild depression, family issues, friend issues, lack of support, from friends or family, those type of stuff, that's the type of stuff that's going to be tackled and addressed during therapy sessions. There's nothing wrong with it. Don't be ashamed of yourself if you opt to go therapy. Don't think that you're not doing it the right way, or you're not going to be seen in the same light as some other guys because they didn't go through therapy. I've seen several people opt to not go through therapy, not deal with their issues that have been underlying and they know are underlying, and once you start hormones, all of that's just going to be multiplied. So here you have these guys who thought that they knew all good and bad and knew they were fantastic and, oh, I just want to start T. Years down the line, now they're dealing with having their anxiety, doubled, tripled, their depression kicking in left and right. It's just, everything's going to be multiplied. Everyone has their own path. Don't feel like you need to follow how everyone else does it. Somebody who's 30 some odd years old starting their transition is going to have a completely different path than somebody who's 19, somebody who's 21, somebody who's 23. It's all about your mindset, where you are in life. Have you spent any time living as a male prior to starting hormones? That's a big thing that a lot of guys want to avoid therapy because a lot of therapists make you go through a 6 months to a year real life experience, which is very good because there's plenty of people out there who jump on the transsexual bandwagon, claim that they fall under the umbrella term transgendered, saying that they want to be, transition and this and that, and then they spend some time, living their life as a male or start taking hormones and undergoing changes and then realize, no, wait, I'm going to stop because this isn't really what I want. I'm not really a transsexual. I'm not, I fall under the umbrella term transgender, which encompasses so many variety of different things, but personally, they discover that they are not transsexual. They have no need to transition. They are happy in their body. They're happy being androgynous. They're happy, in that in-between land, and there's no need for them to be on hormones. There's no need for them to go through surgery. If they'd gone to therapy, these issues would have been talked about. If, they would have opted to a real-life experience prior to starting hormones, these things would have been discovered, and thus they would have saved themselves a lot of headache and whatnot in between. So, personally, I think therapy there's nothing wrong with it. I went to therapy. I lived my life as a man for a good 6 months before I started therapy, so I only spent about 3 months in therapy. Performing drag also helped me a lot with it too, allowed me to identify as male on stage and within a crowd and be comfortable identifying as male and kind of give a mini test run, a couple nights a week, couple nights a month, whatever it was when I had my shows. All this stuff is great. Jumping right into taking testosterone, not always the best thing for some people. Some people, fantastic, their mindset is completely good, they have no underlying psychological issues, nothing. That's fantastic. If you have no underlying issues, you've never suffered from any depression, you have complete support, you have a strong support base, then that's fantastic, and maybe going straight to testosterone is good for you. But if you don't have a solid support base, you don't have a solid group of friends, you're not in a committed relationship, your parents aren't behind you 100%, you're unsure about things, you want more information, you want somebody to be there for you through your first couple months of transitioning, through some of the spikes, the emotional changes, the initial get the ball rolling steps, that's where your therapist is going to come in handy. When you lack that support system, or you lack that person that you feel comfortable enough to sit down and talk to about these things, that's what your therapist is there for. So if you opt for therapy, go for it. I personally think it's fantastic. I feel that everyone should at least attend 1 or 2 sessions with the therapist prior to starting hormones, just to make sure that, you know, someone else who is professionally trained, you know, and has had multiple experiences dealing with people in your situation, also feels that you're ready, or can give you a timeline, or can give you a, you know, stepping stone. This is what's going to happen. These are some of the changes you're going to incur, because basically changes between everybody is going to be different, and that's going to be, I'll do a completely different video as far as the changes once on testosterone happen. But I mean, you know, I went to my therapist several months after I started hormones. I had bad breakups and didn't even know how to deal with them, and everything was amplified because I had gone on hormones. My therapist was there for all of those things. You know, that's the route I chose. I chose to go therapy, then hormones, then have surgery. Everyone has their own path. Don't feel pressured by anyone else around you. Don't feel like you have to keep up with the pace of everyone else. Your path, your transition, your life. Basically, do what you feel right. Talk to a therapist at least once, if not, you know, a couple times before you start hormones. Basically, that's my take on things. Therapy, go to at least 1 session, if not multiple sessions. If you have underlying issues, just admit it. Don't try and be a big man and be like, no, there's nothing wrong. I don't have anything that I'm trying to deal with. I'm perfectly fine. You know, if there's something there, see somebody about it. Talk to somebody about it. Get some help. Figure it out, because it's just going to get amplified once you start hormones. Alright, I think that's all I'm going to spout on this topic. I'm pretty sure it's controversial, and everyone has their own opinion, but like I said, this is my personal opinion. Take it or leave it. This is just what I feel from my experiences and my knowledge and my background, and having a psychology degree kind of give me a little insight and be able to point out things a little bit easier when it comes to people in those terms. So, alright, have a good night, guys.